In the name of Allah, I start this video. I'm Isra, student of Ore State University International Medical Faculty. I have got the topic Anatomy of Stomach and Gastric Ulcer, which was guided by our teacher Kurmanbev Nurjigit. Stomach is an organ which is roughly J-shaped at rest, and the size and shape of it varies due to volume of food or fluid it contains, position of body, face and respiration. High and transverse is in obese and short persons, elongated in thin person. And parts of stomach which can be seen are fundus, body, antrum, incisura, pylorus. Mean capacity of stomach is 30 ml at birth, 1000 ml at puberty and 1500 ml at adult. There are two openings, two surfaces and two borders. Gastric orifice are two. They are cardiac orifice and pyloric orifice. There are two curvatures, lesser curvature and greater curvature. There are two surfaces, anterior superior and posterior inferior. Functions of stomach, they are digestion, produces acid, reservoirs of food, slows food entering intestine, help with vitamin absorption, that is mainly vitamin B12. Let me start with the definition of ulcer. An ulcer is a medical condition caused by a break in a bodily membrane. Common forms of ulcers include skin ulcer, genital ulcer, mouth ulcer, peptic ulcer, venous ulcer, and ulcerative colitis. Gastric ulcer, a break in the normal tissue that lines the stomach. It is a type of peptic ulcer. Gastric ulcers are mainly common in the late middle age where the incidence increases at age. Male are most prone than female as the ratio goes 2:1. More common in patients with blood group A. Use of NSAIDs associated with a 3 to 4 fold increase in risk of gastric ulcer, less related to Helicobacter pylori than duodenal ulcers, about 80%. 10 to 20% of patients with gastric ulcers have a concomitant duodenal ulcers. Risk factors seen here are NSAIDs, Helicobacter pylori infection, smoking, increasing age, alcohol abuse. Symptoms of gastric ulcer disease are epigastric pain after meal or during meal, upper dyspeptic syndrome, that is loss of appetite, nausea, vomiting, flatulence. Vomiting brings relief, reduced nutrition, loss of weight. Here, pathogenesis seen are multifactorial, and it is the disbalance between protective and aggressive factors. Protective factors are saliva, food, alkalic duodenal fluid, mucus mucin, fast regeneration of gastric epithelial cells, well-perfused gastric mucosa. Aggressive factors are hydrochloric acid, pepsin, bile acids, Helicobacter pylori, drugs like analgesics, aspirin and corticoids, nicotine, alcohol. Complications of gastric ulcers are vomiting, nausea, loss of appetite, blood or tarry stools, severe abdominal pain, penetration or perforation, bleeding, obstruction, and cancer. Therapy here are conservative and surgical. In conservative therapy, regular lifestyle, prohibition of the smoking and alcohol, diets like proteinaceous diet, milk and milk products. Pharmacological conservative therapy are antagonists of H2 receptors, antacids, anticholinergics. In surgical therapy, B1 B2 resection, proximal selective vagotomy with pyloroplastic and sutures of perforated or hemorrhagic ulcers. Here, the prevention can be seen are lifestyle changes, that is stress reduction and rest. Here, the patient may need to avoid situations that are stressful or exhausting. A rushed lifestyle and an irregular schedule may aggravate symptoms and interfere with regular meals taken and smoking cessation can help decrease the secretion of bicarbonate from the pancreas into the duodenum, where it results in increasing its acidity. Smoking may significantly inhibit ulcer repair, therefore, the patient is strongly encouraged to stop smoking. Dietary modification which can be seen here are, here it is required to avoid oversecretion of acid and hypermotility in the GI tract. Therefore, avoiding extremes of temperature and overstimulation from consumption of meat extracts, alcohol, coffee and other caffeinated beverages and diets rich in milk and cream. In addition, an effort is made to neutralize acid by eating 3 regular daily meals. Thank you.